When we talk about growing older, most people like to wrap the subject in soft words, polite phrases, and gentle reassurances. We often hear things like, age is just a number, or you're only as old as you feel. These sayings are comforting, and to some degree, they carry truth. But if we are being completely honest, if we are willing to face reality with courage, we must also accept that the journey of aging does not come without challenges. Doctors who see older people every single day understand this reality far better than most. They sit with seniors, they examine their bodies, they analyze test results, and they witness firsthand the impact of years of choices, both good and bad. When doctors speak frankly about older people, what they think is not always sugar-coated, and it is rarely glamorous. Yet, these ugly truths are not meant to shame or frighten, they are meant to awaken. They are meant to push seniors to acknowledge what is happening in their bodies so that they can take responsibility for the years they still have ahead. The courage to face reality begins with admitting that aging is not simply a passive event that happens to us, it is also a reflection of how we have lived. A doctor can often look at an older patient and within minutes recognize the signs of a life spent neglecting exercise, consuming poor diets, or allowing stress to dominate the mind. Wrinkles, weakened muscles, brittle bones, failing vision, these are not only the results of time, they are also the results of years without consistent self-care. Doctors know this, and though they may not always say it out loud, they often think to themselves, if only this person had started earlier, they would not be suffering so much now. That thought is not born from judgment, but from experience. They have seen the difference between two 70-year-olds, one who still walks with strength, lifts weights, eats balanced meals, and maintains a sharp mind, and another who can barely climb a staircase because decades of inactivity and poor diet choices have stripped away their vitality. The contrast is striking, and it tells doctors an undeniable truth. Much of what we call old age is preventable suffering, but the challenge is this: most seniors do not want to hear it. They want the doctor to prescribe a pill, to offer a simple fix, to find a treatment that erases decades of neglect, yet medicine has limits. A pill may lower blood pressure, but it cannot rebuild the strength of your heart if you have not exercised it. A tablet may help stabilize blood sugar, but it cannot reverse the consequences of years of sugary indulgence. Surgery can replace a hip, but it cannot restore the natural resilience you would have had if you had cared for your bones decades earlier. Doctors know these things deeply, and so they carry within them a silent frustration. They wish their older patients would take ownership instead of waiting for miracles. They wish seniors would accept reality with courage, look at their own reflection in the mirror, and say, if I want my last years to be good years, I must face the truth about my body and do something about it. Facing reality also requires courage because truth can sting. It is painful to admit that some of the struggles you are experiencing today are not just the result of bad luck or genetic destiny, but the sum of your habits. If you are out of breath from climbing a single flight of stairs, it is not simply because you are old, it is because your lungs and muscles were not challenged for too many years. If your joints ache with every step, it is not only because time has passed, but also because your body was not consistently protected with proper movement, stretching, or strengthening. If your doctor tells you that you are at risk of heart disease, diabetes, or stroke, that is not just normal aging. It is the outcome of choices layered on top of each other over decades. That may feel harsh, even unfair, but here is the gift within the truth: which you built over time can still be rebuilt. The body is more forgiving than we realize, and doctors know this too. Even at 60, 70, or 80, if you decide to move, to eat well, to strengthen your muscles, to discipline your mind, your body will respond. It may not respond like it did at 20, but it will respond enough to give you more energy, more independence, more dignity, and more years worth living. Many doctors silently wish that seniors would shift their mindset away from fear and denial. Too many older adults sit in a waiting room, anxious about what the doctor might say, hoping that everything will be normal, and yet unwilling to do the real work outside the clinic. Denial is a heavy blanket. It covers the truth for a little while, but eventually the truth bursts through. What if instead seniors walked into the doctor's office with courage? What if they were willing to hear not only the diagnosis, but also the responsibility behind it? That is what facing reality means: to hear the words, "You need to lose weight," or "You must exercise," or "You need to manage your stress," not as punishment, but as a call to action. Doctors are not trying to insult. They are trying to push you toward a better future. When they say those things, what they are really thinking is, "Oh, I still see hope in you." If you take this seriously, you can live better, but only the courageous will hear that message and act on it. There is another layer of reality that requires courage to face the awareness that time is not unlimited. Doctors think about this constantly. They see patients die, they see lives cut short, and they know that every year, every month, every week matters. Many older adults live as if they can continue ignoring their health and somehow buy more time later. Doctors, however, see the truth later is not guaranteed. If you wait 5 more years to start exercising, those years might cost you the chance to move freely ever again. If you delay changing your eating habits, you may develop a condition that can no longer be reversed. Facing reality means confronting mortality, not with fear but with urgency. It means recognizing that the clock is ticking, but also realizing that every day is an opportunity to build strength, resilience, and peace. Doctors know that seniors who take action today are the ones who walk into their offices years later with vitality, surprising everyone who thought they would decline. That is the picture of reality faced with courage. Facing reality is also about recognizing the emotional truths of aging. Doctors notice that many seniors carry bitterness, regret, or sadness about lost youth. They see people who are depressed because they can no longer do what they once did, and they see how that mental state worsens physical decline. What doctors wish more seniors understood is that mental discipline is as important as physical discipline. If you believe that aging is nothing but decline, your body will follow your belief. If you tell yourself you are too old to exercise, to eat differently, to learn something new, then your body will obey that command. Facing reality does not mean accepting defeat. It means acknowledging the challenges and choosing to rise above them with a disciplined, positive spirit. Doctors are inspired when they see older patients who embrace their age with energy, who refuse to wallow in excuses, and who maintain dignity not by ignoring reality, but by meeting it with strength. That is what Ernestine Shepherd has modeled for years. She does not deny her age. She embraces it while proving that the human spirit, when disciplined, can rewrite the script of aging. The courage to face reality also means not comparing yourself to the younger version of you, but comparing yourself to the alternative. You are not in competition with your 20-year-old self. You are in competition with the version of yourself who might decline if you stop trying. Doctors see 2 paths in every older patient. One path leads to weakness, dependence, and loss of dignity, while the other leads to strength, independence, and vitality. Which path you walk is not written only in your DNA, it is written in your choices today. Courage means saying, I choose the better path, even if it is hard, even if it requires me to sweat, even if it forces me to change habits I have held for decades. Doctors know the ugly truth. Most seniors are not willing to make that choice. But those who do are the ones who inspire, the ones who live not only long lives, but good lives. So yes, doctors may think things about older people that sound ugly on the surface, that many are lazy about their health, that many deny responsibility, that many expect quick fixes instead of discipline. But if you listen beneath the surface, what they are really saying is, please take ownership. Please face the truth. Please use the time you have left to become stronger, healthier, and more vibrant. That message may sound tough, but it is born from compassion. Facing reality with courage is not about giving up. It is about waking up. It is about standing tall, no matter your age, and deciding that while you cannot control every aspect of aging, you can control your attitude, your habits, and your willingness to fight for your vitality. Doctors respect that. They admire it. And when they see an older patient who walks into the office radiating strength, determination, and courage, they think to themselves, this is how aging should look. This is what it means to face reality with power. When we talk about aging, many people prefer to dress it up in gentle language, to pretend that it is simply a natural process that happens to everyone and therefore requires no deep reflection. They will say things like, it's just part of life, or growing old is inevitable, so why worry? These words may be comforting, but they often mask the real truth. Doctors who spend their entire careers observing the process of aging in hundreds or thousands of people do not have the luxury of denial. They see the honest, often unspoken reality of what happens when the body is neglected over decades. They see the difference between those who take care of themselves and those who do not. They see the difference between people who choose courage and discipline versus those who allow excuses and comfort to dominate. And because of this experience, their thoughts about older people are often harsher, more realistic, and less sugar-coated than the phrases most seniors prefer to hear. The truth can sting, but it is a necessary sting. Facing reality with courage means allowing yourself to hear that truth, to look directly at the evidence in your own body and your own habits, and to accept that while time changes all of us, much of what we suffer is not simply fate, but the result of choices we have made along the way. Doctors often recognize within moments of seeing a new, older patient whether that person has lived with discipline or neglect. They can tell by the way the person walks into the office, by the strength of their grip during a handshake, by the clarity in their eyes, even by the tone of their voice. Two people may both be 70 years old, but one may stand upright, move confidently, and project vitality, while the other may shuffle slowly, struggle with breath, and radiate fatigue. Doctors know that while both individuals are the same age chronologically, biologically they are not even close. And the reason is not hidden, it is written in their choices. The one who maintained some exercise, cared about nutrition, and practiced positive habits over time has preserved much of their vitality, while the one who neglected these things allowed time and neglect to multiply their effects. The truth is clear to any medical professional. What many people attribute to just getting old is often the direct result of preventable neglect. That is a difficult truth for many to hear, but it is one of the most powerful to face. If your suffering is entirely the fault of fate, then there is nothing you can do. But if your suffering has roots in your habits, then change is possible and the future can be reshaped. That is where courage must step in. Courage to admit that you hold more responsibility than you thought, and courage to take action even now. Too many older adults walk into a clinic with the hope that medicine can undo decades of poor living. They want the doctor to prescribe a pill, offer a quick treatment, or give a procedure that erases years of damage. But doctors, though they may provide treatments, know the limits of medicine. A pill may bring down cholesterol, but it cannot restore the arteries to the condition they would have been in if the person had eaten differently decades earlier. A surgery may replace a joint, but it cannot recreate the strength of a body that has been nurtured with movement since youth. Treatments exist, but they are not miracles. They are corrections offered after years of neglect, and they always come with their own risks and limitations. This is why many doctors carry a quiet frustration. They wish their older patients would not place all their hope in medicine alone, but would accept responsibility for the parts of health that only lifestyle can repair. Facing reality with courage means abandoning the illusion of quick fixes and recognizing that your body is still listening to you. Even now, it will respond to exercise. It will respond to healthier food. It will respond to better sleep, lower stress, and stronger discipline. Doctors know this because they see the difference in their patients, those who take responsibility and those who do not, and the gap only widens with age. The hardest part of facing reality is accepting that some of the pain, weakness, or limitations you feel today are not simply because of aging itself, but because of long-standing choices. If you get winded climbing a single staircase, it is not only because you are older, it is because your lungs and muscles were not challenged often enough. If your joints ache constantly, it is not simply the years, it is also the absence of consistent strengthening and stretching to protect them. If your doctor tells you that you are at risk for heart disease or diabetes, this is not just a curse of age, it is the consequence of years of habits layered one on top of the other. That realization can hurt, but it can also empower. Because if your own habits have brought you here, then new habits can take you somewhere better. Even in your 60s, 70s, or 80s, if you make the decision to exercise regularly, to improve your diet, to stay active mentally and socially, your body and mind will reward you. Doctors know this as well. They have seen seniors who take up walking, lifting weights, or practicing yoga late in life and manage to regain energy, balance, and independence. They may not erase all the years, but they reclaim enough strength to live with dignity. The body is more resilient than most people believe. The tragedy is that many never give it the chance to prove that resilience because they cling to excuses instead of courage. Doctors often notice that denial is one of the biggest obstacles for older patients. Many arrive in their office fearful, not because of the disease itself, but because of what hearing the truth might mean. They prefer not to know, or they minimize their symptoms, or they avoid checkups altogether. They live in the comfort of, maybe nothing is wrong, until the day something serious forces them to face reality, often when it is too late. This denial frustrates doctors because they know that early intervention could save lives, that small changes could prevent large disasters. Courage means choosing not to hide. It means being willing to hear the truth from your doctor, even if it is unpleasant, and being strong enough to accept that diagnosis as a challenge rather than a death sentence. When a doctor tells you that you need to lose weight, or that you must change your lifestyle, or that you need to exercise more, they are not insulting you. They are opening a door. They are telling you there is still time to change this outcome. And if you have the courage to hear those words without anger or defensiveness, you can walk through that door and begin to build a stronger future. Time itself is another reality that doctors know seniors often ignore. They see how quickly decline accelerates when changes are not made. They know that waiting 5 more years to take your health seriously can make the difference between living independently or depending on others for the rest of your life. They know that the body can adapt and heal, but only if you give it the chance before it is too late. Facing reality requires courage because it demands urgency. It asks you to accept that your time is not endless and that every day wasted in denial is a day lost to building strength and vitality. This is not meant to create fear, but to awaken determination. If you know the clock is ticking, then every moment becomes more precious. You no longer delay your health for tomorrow. You claim it today. There is also the reality of the mind, which doctors see as clearly as the body. They notice how attitude, discipline, and outlook affect the aging process. A senior who constantly complains, who says I am too old to change, or who believes decline is inevitable will almost always prove themselves right. Their body will follow their belief, and their decline will be steeper. On the other hand, those who keep their minds disciplined, who say I can improve, who seek growth and learning, who treat every day as an opportunity, age differently. Doctors admire these patients because they see how mental strength feeds into physical resilience. Courage is not only lifting weights or changing diets, it is also the courage to believe in possibility, to refuse to surrender to the stereotype of aging, and to cultivate positivity even in the face of challenges. Doctors notice that when the mind is strong, the body often follows. The truth may sound unkind when voiced plainly. Doctors may think that many older patients are careless, that they expect medicine to do what they should have done for themselves, that they live in denial instead of discipline. But beneath that truth is another, more hopeful one. Change is always possible, and courage is always rewarded. Doctors secretly cheer when they see an older patient who decides to fight for their health, who refuses to give in, who shows up not asking for a miracle pill, but asking, "What can I do?" That kind of patient inspires them. That is the patient who proves that while aging cannot be stopped, it can be transformed. And that transformation begins the moment a person decides to face reality with open eyes and an open heart. To face reality with courage is to stop hiding from the truth of your body. It is to listen without defensiveness when your doctor gives you advice. It is to take responsibility for what has already passed and to take control of what can still be shaped. It is to admit that time is limited, but also to accept that within that time lies enormous potential for strength, dignity, and joy. Doctors see the painful results of denial every day, but they also see the extraordinary results of courage. The choice lies within every senior. You can continue to avoid, to excuse, to depend on medicine alone, or you can decide that today, no matter your age, you will face reality with courage and begin writing a stronger chapter of your life. That is the truth doctors wish every older person would hear, not because it is easy, but because it is the only path to a future worth living.